Hello, I'm Dr. Kyla Mills, a neurosurgeon in the Department of Neurosurgery at Duke Hospital. Thank you all for taking the time to be here today. I'd like to discuss an important opportunity for our hospital, one that has the potential to significantly improve patient outcomes, enhance surgical precision, and increase the overall efficiency of our operating rooms. As many of you know, neurosurgery is one of the most delicate and high-risk specialties in medicine. When we perform procedures such as brain tumor resections, we are operating in areas where even a millimeter of error can affect critical functions like speech, movement, memory, or vision. Traditionally, surgeons rely on preoperative imaging in their own spatial awareness during surgery. However, once the procedure begins, the brain can shift slightly, a phenomenon known as brain shift, which makes it more difficult to rely solely on static images. This can lead to longer surgical times, increased fatigue, and a higher risk of complications. Without advanced intraoperative guidance, we may also need to take a more conservative approach, potentially leaving behind tumor tissue to avoid damaging healthy brain structures. While this protects function, it can sometimes impact long-term patient outcomes. So the challenge we face is clear. How do we maximize surgical precision while minimizing risks, reducing operating time, and improving recovery for our patients? Today, I'll be presenting a solution that directly addresses these challenges. The solution we are proposing is the implementation of a neural navigation system such as the Medtronic Stealth Station or BrainLab platform. To put it simply, this technology functions like a GPS system for the brain. It allows us to track surgical instruments in real time while referencing highly detailed three-dimensional images of the patient's anatomy. Before surgery, we upload MRI or CT scans into the system. During the procedure, specialized sensors track the exact position of our instruments and display them on a 3D map of the patient's brain. This allows us to see exactly where we are at all times, down to just a few millimeters. This real-time guidance is especially valuable when operating near critical functional areas such as regions responsible for speech or motor control. Instead of relying on estimation, we can navigate with confidence and precision. Another major advantage is that it allows for smaller, more targeted surgical openings, also known as minimal invasive craniotomies. This reduces trauma to surrounding tissues, shortens recovery time, and improves cosmetic outcomes for patients. Additionally, the system enhances surgical planning. We can map out the safest and most effective approach before ever making an incision, which improves both efficiency and consistency in the operating room. What you're seeing on this slide are examples of the system inference, including the workstation, the 3D anatomical mapping, and how instruments are tracked during surgery. Overall, this technology transforms neurosurgery from a large experience-based practice into one that is guided by real-time data and precision imaging. Now let's take a look at the clinical evidence supporting this technology. Neural navigation systems are capable of achieving an accuracy of approximately 2 millimeters when tracking surgical instruments. In neurosurgery, that level of precision is incredibly significant, and it can be the difference between preserving or damaging critical brain function. In spinal procedures, studies have shown that the use of navigation increases correction instrument placement rates to nearly 99% compared to about 89.5% without navigation. That's a sustainable improvement in accuracy and safety. In brain tumor surgery, specifically neural navigation has been associated with a greater extent of tumor removal. This is important because more complete resections are directly linked to improved survival rates and reduced likelihood of reoccurrence. Additionally, patients benefit from fewer complications, including reduced risk of neurological deficiencies, infections, and post-operative complications. This translates to shorter hospital stays and faster recovery times. Additionally, another important outcome is the reduced need for revision surgeries. When procedures are done accurately the first time, we avoid the physical, emotional, and financial burden of additional operations. From a quality of life perspective, patients who undergo navigation-assisted surgery often experience better functional outcomes, meaning they are more likely to return to their normal daily activities. Overall, the data consistently shows that neural navigation improves precision, enhances safety, and leads to better patient outcomes across multiple types of neurosurgical procedures. Of course, any new technology requires a financial investment, so let's break that down. The upfront cost of a neural navigation system typically ranges between $250,000 and $500,000, depending on the model and features selected. In addition, there is an annual maintenance cost of approximately $20,000 to ensure the system remains updated and fully functional. Training is also an important component. Each surgeon may require between $5,000 and $10,000 in training to become proficient with the system, along with additional training for operating room staff. While this may seem like a significant investment, the return on investment is multifaceted. First, fewer complications mean lower costs associated with the ICU stays, extended hospitalizations, and readmissions. Even a single avoided complication or ICU stay can save tens of thousands of dollars. Second, increased surgical efficiency allow us to perform more procedures with the same time frame. Shorter surgeries mean improved operating room utilization and ability to treat more patients. Third, offering advanced technology enhances our hospital's reputation. It positions us as a leader in neurosurgical care, which can attract more patients, referrals, and top-tier surgical talent. Finally, improved patient outcomes contribute to higher patient satisfaction scores and better overall performance metrics, which are increasingly important in value-based healthcare models. When you consider both the clinical and financial benefits, this technology represents not just a cost, but a strategic investment in the future of our hospital. Finally, let's discuss how we would implement this system. The process is straightforward and can be completed in several key steps. Step 1 is obtaining approval and moving forward with the purchase of the neural navigation system. Step 2 involves installation and integration with our existing imaging infrastructure, such as MRI and CT systems. This ensures seamless workflow within our operating rooms. Step 3 is comprehensive training for surgeons and operating room staff. This includes hands-on sessions and simulation-based learning to ensure everyone is confident in using the technology. Once the system is in place, we will begin a phase of performance tracking and outcome evaluation. This allows us to measure improvements in surgical accuracy, patient outcomes, and operational efficiency. In conclusion, investing in neural navigation technology aligns directly with our mission to provide the highest quality of care. It enhances precision, improves patient safety, reduces complications, and supports long-term financial sustainability. This is an opportunity to elevate our neurosurgical capabilities and position our hospital at the forefront of innovation in patient care. Thank you for your time and attention. I would be happy to answer any questions you may have. Once again, I am Kyla Mills, Doctor Neurosurgeon at Duke Hospital. Thank you.